Physicians spend hours of their days trying to find answers to questions that they face when see patients. They go to Google or they go to PubMed or they go to UpToDate and read articles. There are some new AI tools that help physicians in finding the answers in a faster way, like ChatGPT or Claude. But the problem with these large language models is that they are trained on a huge amount of data. It's not only medical data, and it can also hallucinate. On top of that, it doesn't give the reference. So still, physicians have to go and find the right articles and to find the right resource of the information that they find. Today we're going to talk about PathwayMD. PathwayMD is an AI tool that it supports physicians in clinical decision making. For example, if a physician sees a patient and they have a question that they don't know the answer, they can go to PathwayMD and just type the question and their AI is going to bring the answer to the physician immediately. On top of that, they also offer other features, which we're going to talk about in details. So without further ado, let's jump in. Let's start by looking at the user interface. It is nice and slick. On the left side, you have different menus. The first menu, when you ask a question about AI, so you're going to go and click on it. It's going to open a chatbot. You ask AI, and then they have other menus. For example, search. We're going to talk about it in more details. The updates they release, and this is updates about the medicine, not about their software. And the library has other underlying submenus. They have subsection about diseases, the studies and research, specific pathways of approaching different medical conditions. They have calculators similar to MD, CalcMD, and also pathways of approaching different findings. For example, if you see abdominal distension, how would you approach it? If you have a GI bleed, how would you approach it? Submenu about the drugs, subspecialties or specialties, and favorite. In the middle, we have the chatbot. I'm just going to go back to the Ask AI. We have here the CME credit, continuous medical education. So as you use the app, or the software, it will accumulate continuous medical education credits. And also here is the history of previous chat. So in summary, the user interface is nice and sleek, and we have many options on the left side, which we're going to see in the next chapters. Let's move on and see what the AI will do if I ask it a question. We can't judge really on the accuracy of the AI, because to judge the accuracy in a systematic way, we have to have like 100 or 200, maybe 1,000 questions, and these questions should be reviewed by physicians who are qualified in the field, they are the gold standard. So what we're going to judge is the consistency of the answer and the quality of the answer. So for example, let's ask PathwayMD a simple question: what is the treatment of community-acquired pneumonia? And let's click on it. So AI is thinking. There's 0, 1, 2, 3, 4, 5, 6, 7, around 6 to 7 seconds lag. It's collecting its answers. So I started typing. There is a bit lag there. So here it says the treatment of community-acquired pneumonia is multi-phased and depends on patient's clinical setting, severity of illness, and presence of comorbidities. That's correct. If I have a patient who can walk and talk, it's different than a patient who is in the ICU intubated. And they go through this, okay, and they give different types of treatments. I'm not going to judge on the accuracy of this, but let's look at the resources. So the nice thing, if you click on a reference, which is very important for us, it says this is a guideline, and this is coming from the IDSA 2019. I'm not sure if there is an update for that, but I think this is something that we use. That's right. It sounds familiar to me. It looks familiar to me. I'm not an infectious disease physician. I'm an oncologist. So just FYI. And then here it talks about, again, guideline empiric antibiotic treatments. It looks like it's from the same reference. And let's scroll down. So it gives you also different references here. So it used this reference from the IDSA 2019, and then it used empiric antibiotic therapy, outpatient setting, patient comorbidities, and then empiric antibiotic therapy in patients. So it looks like it pulled the answer from the guidelines, and this is the IDSA, the infectious disease guidelines. They are 2019 guidelines, and also on top of that, it looks like it used the IDSA 2007. I'm not sure if this is needed, because for me, I need the most recent answer. But again, the accuracy of the answer should be judged by infectious disease physician. So it pulled like many guidelines, and that's the nice thing about it. So if I ask a question, I'm not sure about the accuracy, I can just immediately go and check the references and the guidelines, and that's what makes PathwayMD different from other AI tools. It really is helpful in clinical decision support. If I will go to UpToDate and like search and find my answer through going through articles, going through different articles, it's not going to be as fast as PathwayMD, right? And the other one, so here I already asked this question in another tab. I just clicked on it, and as you can see, there is consistency. So I asked the same question twice. There is consistency. So empiric antibiotic therapy for outpatient comorbidities, inpatient severe corticosteroids, duration of antibiotics, and here if I see empiric antibiotic therapy, maybe it bolded it a bit, but in general there is consistency. So I would say the answer is consistent and the answer is comprehensive. I can't judge on the accuracy. Then I want to talk about the updates tab. Updates about the latest research, and then here you have two under categories, for you and latest. For you, it mainly shows me updates related to me, like the specialty, which is very good because like instead of going and subscribing to newsletters, you get research updates here. So here it says that the LAURA study added osimertinib in patient with unresectable stage 3 EGFR mutated non-small cell lung cancer. Okay, so this is something interesting because like we usually use osimertinib in the clinic. So here it looks like they are bringing osimertinib for patients with stage 3. We usually use it in stage 4. So this is a new study. I'm interested in it, and I didn't know about it actually. PathwayMD helped me. And then here it says like it's a study, but also it's a trending. Olympia 2 used nemolizumab in patients with moderate to severe prurigo nodularis. It feels like this is more dermatology. It could be oncology, but it's more skin oncology. It's not something I'm that familiar with. Then there is a release of a drug called lazertinib. The FDA approved lazertinib, an HFGFR tyrosine kinase inhibitor for treatment of non-small cell lung cancer. This is also interesting. That's something I didn't know. Another study called Helix, study of tranexamic acid in patients undergoing liver resection of cancer-related indications. So as you can see, the studies are really related to me as an oncologist, which is really cool. And then here they have the latest studies, and I think these are more random studies. Bisoprolol in patients with chronic obstructive pulmonary disease at high risk of exacerbation. So PathwayMD knows that I'm an oncologist, so these are more random studies and they are not related to my specialty. So this is a good way of staying up to date, and instead of subscribing to newsletters, you get updates here. I'm not sure, I did not compare this to different newsletters that I subscribe to see the response or to see if it is as up to date as the newsletters. But again, it's a great start for people. And one other thing unique about PathwayMD is it has the library section, and in the library section there are other subsections. Like for example, you can go to the diseases section, which we are in right now, and then like you can see different diseases and then studies, pathways, calculators. We're going to go through them each one at a time. So if I go to the diseases, and then it is categorized by like the letter A, B, C, D, E until Z, and then they also have some advertisement here. And let's just do something simpler like chest pain, for example. So if I click on chest pain, and it starts by talking about the resources it uses to talk about the chest pain. So it's just like a textbook, but for free and in an organized way. The diagnostic investigation, what to do, and then it tells you that according to this society's guidelines, we do X, Y, and Z. And so ECG, troponin level, echo, chest radiograph, evaluation for acute coronary syndrome, and it's very well, nice written, comprehensive, textbook-like. Am I gonna use it? I'm not sure, because like the whole idea of using AI is I want to find the answer quickly without me going to the text. But the nice addition here, they also have calculators. So usually physician, when they want to use calculator, they go to MD Calc, but here you have all the calculators that you need that are related to this presentation. which is cool. So for example, if I have a patient with heart failure and they have shortness of breath, I want to categorize their shortness of breath according to how severe is the shortness of breath. I can classify them to class 2, 3, or 4 NYHA, which helps me to communicate with other healthcare providers or give me some prognostic value. So this is something unique about PathwayMD. Then under library, they have this unique studies section, which is also unique. I didn't see in other clinical decision support tools. And this studies section literally gives you clinical trials. And for example, like I'm now in the C section, I want to go to the Cleopatra trial. It's a very prominent trial in breast cancer in oncology. So if I click on it, so it's nice. Look at this. So trial question: what is the effect of pertuzumab in addition to trastuzumab and docetaxel in patients with HER2-positive metastatic breast cancer? So it summarizes the question, and then it tells you this is multi-center, double-blinded, randomized clinical trial, the population included in the trial, and what were the intervention arms, and what were the primary outcomes. So as you can see, they compare placebo to pertuzumab, which is a breast cancer treatment, and very nice, visually appealing result. And if I go to the paper, I might see the result there, but I don't want to go through the paper. I want like something direct, short, and sweet. So this summary section is very good written because it helps me to understand who are the patients who were included, what are the main results, and what are the main safety outcomes. For example, let's say I have a patient, I'm going to start on pertuzumab, and what are the things that I want to watch? Okay, so what were the common side effects seen in this type of trial? The diarrhea, rash, and muscle spasms, and then it tells you conclusion, and then tells you which disease, and then like boom, you have the reference of the trial. So this studies section is very nice and well written, and it's a great resource in addition to what they offer, and it helps me to understand clinical trials or studies in a nice, visual, appealing way. Now let's move on to other subsection. So this subsection called pathways. Pathway is mainly a diagnostic algorithm. As physicians, when we approach diagnosis of any medical condition, there are steps in our mind that we think of step by step. Every physician have their own pathway of approaching different diseases. For example, if I click on achalasia, which is a problem that happens in the food pipe that links the mouth to the stomach, sometimes it gets really narrowed, and click on it, so it takes me through pathway. What are the things I need to send, or what are the investigations I need to order as a physician when I think about this diagnosis? So this is a nice way of systemizing the approach of different medical conditions. Again, I'm not going to comment on the accuracy of this. I'm not a gastroenterologist, but it's a unique way of also refining medical decision taking for physicians. Another unique section that they offer is the library, and then you go to calculators. It's the calculator section, and the calculator sections is really, they brought all the calculators that we usually use from MD Calc and put them here. What does that mean? So as physicians, when we approach different medical conditions, we have equations and calculators that help us to decide if we're going to do a medical decision or not, or if we're going to offer a treatment or not. And in a similar way, we have tools that help us in our clinical decision taking. So we usually go to a website called MD Calc. Pathway, what they do is they brought all these calculators, and also they put them on their platform. So if I click on calculators, and let's go to the CHA2DS2-VASc score. So if I have a patient with atrial fibrillation, which is funny heart rhythm, I use a score to decide if these patients has to be on blood thinner, and I click on it. So let's say I have a patient who's like 66 years old. She's a female. She does have hypertension and diabetes and has a history of heart failure. She has a history of stroke, and she doesn't have a history of peripheral arterial disease. So it says the risk of ischemic stroke is 11.2%, and the risk of a stroke or TIA is 15.7%. That's not what usually, so it didn't tell me the score. So I need the score to calculate if this patient will need anticoagulation or not. So in real life, a patient like this is very high risk of forming a clot, so I will put them on anticoagulation. This is very obvious to me, but like I would have liked if they mention what is the CHA2DS2-VASc score itself, and then the risk of ischemic stroke. So it's a good tool, but I think they can work on it and refine it a bit more. Now let's look at other tabs quickly. So we have the Findings tab. Findings, it's how to approach different symptoms or signs that you find in the patient. For example, if I go to Findings, as you can see here, and then again it's organized in an alphabetical manner, I click on abdominal distension, so it will open a different differential diagnosis, the common causes of abdominal distension and less common causes. But to fully access PathwayMD list, you have to have the paid subscription. Then you have drugs subsection. For example, if you click on a drug, for example acetaminophen, which is like Tylenol or extended release Tylenol, it gives you the dosage in adults, and for example if you're going to use it for fever, what should be the dosage, and if you're going to use it for pain, what the dosage should be, if there are any safety risks, if there are any contraindications, and what to think of before prescribing this drug. How do you do dose adjustment for the drug? It's also mentioned here. So this is something that we do a lot in medicine, because sometimes we might have a patient with renal dysfunction or kidney dysfunction or liver dysfunction, and we need to adjust the medications according to this. So I will need to access resources to help me to know how to adjust different drugs. So it's either going to be the pharmacist who works with me or clinical decision support tools. Other resources that are commonly used, like UpToDate, they also offer drugs section, but technically speaking, or like talking about from a user interface perspective, I find this is simpler. They have really nice icons and they have different subsections, and it is more visually appealing when compared to UpToDate. But I still use UpToDate, don't get me wrong. And here are the adverse reactions that are associated with Tylenol and references. So it's relatively, I would say, shorter. I can't share UpToDate information because UpToDate information is more paid subscription. This is a free version. That's how I'm able to do my review. And then you have this subsection that's called the Specialties. If you go, for example, to specialty and you click on cardiology, so I think it's going to be topics and the studies and calculators that are related to that specialty. Again, different way of organizing things. So those are the last three sections that I wanted to talk about. If you like this video, please hit the like and subscribe button. If there are any AI tools you want me to review that help you in your clinical work or in your day-to-day as a physician or even as a patient, please let me know. I will see you in the next video.